A breast lift procedure is often combined with a breast augmentation. It can be done on its own, and there are three different ways of doing a breast lift. My least favorite way is what we call a donut mastopexy or donut lift. It involves a circular incision around the areola. You're removing a donut shape of skin and areola around the nipple and areola, and then you're running a stitch from the outside donut to the inside and pulling that together just like you would a purse string. The reason I do not like this procedure is that it tends to flatten the breast. It really doesn't give you much of a lift, and then you're left with a permanent string on the areola outer edge that is palpable. You can feel it. It's a permanent stitch because if it wasn't permanent, that areola would stretch back out. The other two options I think are equally nice for giving you a very nice shape to the breast. One has a little bit more scarring, and that's the anchor incision. And we will do anchor incisions for people who have a lot of extra skin and have to raise the breast by quite a bit. So as the name implies, the incision looks like an anchor. It's an incision that goes around the areola, comes down vertically, and then is in the crease along the bottom of the breast, and that's where the anchor comes in. But through that incision you can really shape the breast. It gives you a nice perky breast and lifts it quite a bit. It also makes the breast smaller, so for people who need a lift and a breast reduction at the same time, this is an ideal procedure. My most favorite procedure for doing a breast lift is called the lollipop incision. It's also called a vertical mastopexy. And as its name implies, it's an incision that looks like a lollipop. So it's an incision that comes around the areola and then straight down like the handle of a lollipop. Through this incision, you get a really nice lift. It gives you a nice protruding breast, a perky breast, and a little bit of reduction in size. So for people who want to maintain the same size or go a little bit bigger, it's often combined with an augment, and these can be done at the same time. Usually a small implant is all that's necessary to give you that fullness in the upper pole of the breast, which is really difficult to get with just a lift, and that's why it's often combined with a augmentation mammoplasty.